intimacy is one of the most common and most dismissed symptoms in women's health. If sex hurts, if penetration causes deep pelvic pain, or intimacy creates fear instead of connection, that is not normal. And it's not something you should learn to live with. I'm Dr. Touchan, a minimally invasive GYN surgeon specializing in pelvic pain and endometriosis care, working with a great organization in pelvic rehab medicine. And today I want to explain why pain with intimacy happens, what it means, and when to seek help. Many patients with painful intimacy are told things like, just relax, use more lubrication, it's just anxiety, that's normal after childbirth, you need pelvic floor therapy only. Well, while lubrication and pelvic floor physical therapy may help some people, they are often used as a way to avoid investigating the underlying cause. And that delay can cost patient years of her life. What pain with intimacy actually means. Pain during intercourse, also called dyspareunia, can be superficial or deep. Deep pain, especially with penetration or certain position, is commonly associated with underlying pelvic diseases. Some of the most common causes including endometriosis, especially deep infiltrating disease. Another very important cause is adenomyosis, uterosacral ligament involvement, cul-de-sac disease, pelvic floor spasm secondary to chronic nerve and nerve entrapment. This pain is not psychological, it's biological. Why pain is so often missed? One of the reasons for that is that pain with intimacy is ignored because imaging like ultrasounds, MRIs can appear normal even when disease is present. Another reason is that women are conditioned to minimize pain, especially pain related to sex. Patients begin to doubt themselves. They stop bringing it up to their physician. They internalize the idea that pain is their fault. That is medical gaslighting, and it's harmful. The impact of that is beyond the bedroom. When intimacy becomes painful, the consequences go far beyond sex. It affects relationships, marriages, self-esteem and body image. It affects mental health, desire and connection. It affects trust in the medical system. I've seen patients blame themselves for something that was never their fault. And now when you should see medical care? You definitely should seek medical care to get evaluating if for pelvic pain or endometriosis specialist. If the pain occurs with deep penetration, pain persists despite pelvic floor physical therapy or hormonal treatment, you have been told everything looks normal, but the pain continues. Intimacy causes fear or avoidance, and pain is worsening over time. Most general GYN exams often miss deep disease that requires expert evaluation and experience. Pain that affects your intimacy is your body communicating to you. It's not malfunctioning. You deserve intimacy without pain. You deserve to be believed, and you deserve answers. If this video resonates with you, share it with someone you know may need to hear this. Thank you very much for listening. And always remember, pelvic pain and pain with intimacy and endometriosis is not normal. Thank you for listening.